treatment of urinary septicemia. The treatment of acute renal infection, including urethral chill, has already been described. Urinary septicemia usually depends upon some form of retention of urine, whether urethral or ureteral. The first requisite for a cure is the relief of this retention. The treatment of pyonephrosis is so special that it is described separately. Vaccines. Vaccines are of no value excepting for the relief of toxic symptoms. I have known patients to derive great temporary comfort from the use of vaccines, but have never seen any permanent good results, and have never known the bacteria or the pus to be driven from the urine by their use. Generally speaking, they are not worthwhile, if not worse than useless, in that they encourage neglect in searching out the real treatment, i.e., the relief of the retention. Pelvic lavage. Lavage of the kidney pelvis is as little calculated to do good when there is chronic retention or chronic sepsis. The benefits attributed to the lavage are doubtless usually due to the passage of the ureter catheter, for it is in these cases especially that the ureter catheter is singularly valuable. The indwelling ureter catheter will often not only carry one by a difficult stage of relatively acute infection, but will also so improve the ureteral drainage that the subsequent course of the case is singularly modified for the good. Diuresis. After the retention has been overcome, catharsis and diuresis are the best means in our possession for the combating of infection and sepsis. In really acute cases, diuresis may do more harm than good if it is pushed to the point of adding to the congestion of the kidney. Indeed, it may be overdone even in chronic cases. But while there is actual sepsis, the patient may often, with advantage, drink 8 to 12 glasses of water a day and receive 1 or 2 colon irrigations. The Murphy drip is also useful, and for emergencies, intravenous or subcutaneous infusions. But it is to be remembered that the object of diuresis is simply to free the kidney of solids, to keep the urine at relatively low specific gravity, to do exactly what catharsis does in the intestines. The practice of depending upon water alone for the purpose of washing bacteria out of the kidney is scarcely justified. It often keeps the patient sick or makes him sicker by adding to the work thrown upon the kidney.